Hello, everyone, and welcome to this live broadcast from World Health Organization headquarters in Geneva. My name is Marta Soszyńska, and I am WHO's communications expert. And today we will be talking about social isolation and loneliness among older people. And I'm joined by Christopher Micton, who is WHO's expert on demographic change and healthy aging. Welcome, Christopher. So we will be talking with Christopher about social loneliness, social isolation and loneliness among older people. But before we move to that topic, I wanted to ask you, Christopher, a little bit more about your work for WHO. What is it that you do exactly, especially around social isolation and loneliness?
Sure. So personally, I work for the Demographic Change and Healthy Aging unit within WHO, and that's in the Department of Social Determinants of Health. And for those who aren't familiar with the term, social determinants of health refer to non-medical factors that influence health outcomes. They're the conditions in which people are born, grow up, work, live in, and age, and as well as the wider set of forces and systems shaping the conditions of people's daily lives. And our social relationships, our social connections, and the lack of social connections, that is social isolation and loneliness, are important social determinants of health. Within our team, I deal with elder abuse, I deal with social isolation and loneliness, with ageism also to an extent, as well as with research, data, and innovation. Social isolation and loneliness is a topic WHO is only starting to address. We haven't done very much in the past. And we want to now address in a more sustained way as part of the WHO and the UN Decade of Healthy Aging, which goes from 2021 to 2030. This UN Decade, if you haven't heard about it, is a UN-wide initiative that aims to improve the lives of older people, their families, and communities by bringing together all kinds of different stakeholders for 10 years of concerted action. And what more specifically we're doing on social isolation and loneliness is, well, we started by developing an advocacy brief on social isolation and loneliness among older people, which we launched a few weeks ago on the 30th of July on the International Day of Friendship. And you'll be able to find a link to this advocacy brief in the comment section below. So you can click on this link and you'll have access to this advocacy brief. It reviews the evidence on this topic, and it also lays out a strategy for trying to deal with this topic of social isolation and loneliness among older people. We also, with colleagues in Germany and the States, did a review of studies on whether social isolation and loneliness increased or decreased during the pandemic and how much it increased by. We're currently engaged in doing something called an evidence and gap map, where you map all the evidence available on this issue, try to identify the gaps, and we're also starting to think about developing an evidence portal where we bring together all the evidence on different aspects of this issue and try to make it as accessible as possible to the general public and to specialists and policymakers, etc. So that's a brief overview of what we're up to in this area.
Thank you, Christopher, for this overview. I think it's a topic that a lot of our viewers will be able to connect to or know from personal life. I will just remind viewers who are just joining us from around the world that we are talking about the issue of loneliness and social isolation among older people. So Christopher, before we move on to questions from viewers, which I'm sure they will have many, I wanted to ask you, what do we mean exactly by social isolation and loneliness among older people? How do we define these two terms?
Yeah, older people is quite simple. We tend to use a cutoff of 60, so it's people who are 60 or above. Social isolation and loneliness, the first thing to know is that they're really quite distinct terms. They're related, but distinct. And social isolation involves really an objective and quantifiable state. And it refers to the absence of or having a small number of social relationships and social interactions. It's something basically you can count. the number of different types of social relationships you have, how often you're in touch with the people, how long the interactions last, etc. It's really something you can count. Loneliness, on the other hand, is a subjective state. It refers to a painful subjective feeling, sometimes referred to as social pain, that results from a discrepancy between desired social relationships and actual social relationships. So that kind of discrepancy between the relationships you want and the relationships you have that causes pain is referred to as loneliness. And the two are linked, but not necessarily that closely linked. Social isolated people are not necessarily lonely, and lonely people aren't necessarily socially isolated. How lonely a person feels depends partly on their culture's expectations of relationships, their own expectations of relationships, their personality. For example, some introverted people need probably fewer social relationships than more extroverted people, and also in the quality of the relationships. So that's the main distinction between the two. Social isolation, very much an objective, quantifiable notion. Loneliness, a feeling of not having your social needs met.
Thank you, Christopher, for these definitions. I think this sounds really interesting. I think for many people, actually, it's the social isolation or loneliness. It's terms that we heard before, but we may not actually know what they mean, or that there is a definition. I wanted to ask you, it's a topic, especially for older people, that I think many of our viewers, again, I already mentioned it, felt personally during the pandemic. What do we know about the extent to which older people today in the world are experiencing these feelings of loneliness and social isolation? Do we have any idea of the extent?
Yeah, we have not a perfect idea, but we have some idea. What we don't have at the moment is global prevalence estimates. For other health problems, we sometimes have estimates, there's, 23% of the people in the world who are suffering from this or that problem. We don't have that for social isolation and loneliness. However, what we do have is a number of prevalence estimates, mainly for loneliness, but a few for social isolation, for a number of regions and specific countries. Just to give you some examples, about between 20 and 34% of people in 25 European countries report being lonely. In the States, it's between 25 and 29%. In Latin America, it's between 25 and 32%. We have some data for China, which suggests it's about 30%. And we also have some studies from India, actually a review of a number of different studies that estimate about 44% of people in India suffer from loneliness. And there are also other estimates from India that are lower. When it comes to social isolation, we have far fewer estimates, but what we have suggests it's about a quarter of older people in the States, and about 20% in India. We also know that people in long-term care institutions experience more loneliness than people in the community. And again, a review of 11 studies estimated that about 35% of older people do. So that's more than 1 in 3 older people in residential and nursing care homes were very lonely. There are also some things we don't know. We don't really know if and how loneliness varies with age. Some studies suggest it's a U-shaped curve, which means that there are a lot of lonely people in the younger age groups and many older people in the older age groups, especially the oldest old. But then there are other studies not showing that. So at the moment, we really aren't sure about how it varies across age. We do know, however, that there's not much of a difference in loneliness between men and women across the life course. We also don't know if the global rate of loneliness is going up or down. Partly we don't have global estimates to begin with, so we can't really know across time. But some studies suggest, like in China, that it's going up. Other studies from Germany or Finland suggest it's going down, and yet other studies show it's not changing. So we're not really sure. I think we can sum up by saying that about 20 to 35% of older people, that's between 1 in 5 and 1 in 3 older people in many different parts of the world are experiencing loneliness that we don't have at this point global estimates, and it's not clear which age group is the most effective. So that's kind of, I think, the main take-home messages regarding the prevalence.
Thank you, Christopher. So that all sounds very interesting. And I have immediately one more additional question about that. You were talking about some data that's available, but it doesn't seem like we have a lot of knowledge about this issue. Is social isolation and loneliness an issue that researchers are not especially interested in, or is it something that is a new area of research? Is this why we don't have that much data? Why is it? Why don't we have more data about it? Because it seems like a very important issue to our societies.
It is, but it's a relatively recent issue, and the connection between social isolation and loneliness and health, and I'll say more about that, but it's a relatively recent issue. It's something that's been studied last 20 years, but more kind of intensively in the last 10, 15 years, and data's accumulating. There's a lot of studies being published, but we don't have enough data in many areas of this problem. And it really is an issue that's got a lot more attention in the last 5, 10 years in some countries. And it's an issue, for example, in England or in Japan, which is really taken very, very seriously. They've even appointed ministers for loneliness in England and something a bit equivalent in Japan. So it's something that's becoming a much more pressing public health and public policy issue. And the amount of research is increasing. But as I said, we don't have data on all aspects at the moment.
Christopher, you mentioned that in your introduction that you have been doing a very interesting work on social isolation and loneliness during COVID for older people. Can you tell us a little bit more about what we know? What happened to people who are older during the pandemic in that regard? What do we know?
Yeah, the results were somewhat surprising. Basically, till recently, we weren't sure whether loneliness had gone up or down. Most people thought it increased during the pandemic, but there were some studies showing that it had gone up, others showing that it had gone down. So with colleagues, as I said, in Germany and in the States, we did what's called a systematic review and meta-analysis. Basically, you take all the high-quality studies, and we identified 31 such high-quality studies, and you put them all together to try to see what they're saying as a body of evidence. And we found that there has been an increase in loneliness, but it's not been a huge increase, and it seems to have affected all age groups equally. Older people were not worse affected by it than other age groups. And I'll just give you some examples of some of the studies. There's one in Hong Kong that found that loneliness, this was moderate loneliness, went up by 11%. Among older people, it went up from 31.8% to nearly 43%. And there was a study in Chile that showed that it had gone up by 5% since the beginning of the pandemic. So yes, it has increased. It's only increased a little bit, in some places more than others, and it doesn't seem to have affected older people worse than other age groups.
Interesting, Christopher. I think many people would have thought that it's a serious issue for older people who may not use internet as much as younger people. But I think it's important to remember that loneliness and isolation can affect anyone, any age, and it's not exclusively an issue of people who, for instance, don't use social media. It can also affect people who do use social media. I wanted to ask you a question from our LinkedIn viewer. We are starting to get more questions. It may be a little bit provocative, so I'm wondering what you're going to tell us about it. So our LinkedIn viewer is asking, is social isolation more a problem of northern countries? So I assume he means northern hemisphere or developed countries.
Probably not. I mean, we can't be sure because we're lacking these global estimates and we don't have data from everywhere. But in the prevalence estimates I just showed you, we have some data from China and from India that suggests it's just as high as in Northern Europe, in the Northern Hemisphere, or in Western high-income countries. There's also some data within Europe showing that rates of loneliness are not higher in more individualistic countries like Scandinavia than in more collectivist countries like some of the Mediterranean countries. On the contrary, there's some evidence showing that people in these collectivist societies sometimes suffer from loneliness more. And that might be because their expectations are much higher. They expect to have many more social connections, many more social interactions, while people maybe in Northern Europe have kind of lower expectations. That's one hypothesis. But basically, we can't say categorically that people in high-income northern countries experience loneliness and social isolation more than people in other parts of the world.
Thank you, Christopher, for clarifying. I think there's a lot of stereotypes also around that issue of loneliness and social isolation. I wanted to ask you, how does it affect people who feel lonely or feel isolated? What do we know about the impact, especially for older people, because we are especially talking about older people, but maybe even in general, as I assume it can be similar probably for different age groups, or?
Yeah, it is. It also has a cumulative effect across the life course. So, you may be suffering from loneliness early on, but the impact or the consequences only manifest themselves later in life. But the impact, particularly the impact on mortality and the impact on health, I think is the single most important kind of aspect of this problem. And we have some of the strongest evidence comes from studies on the impact on mortality of social isolation and loneliness, the impact on mental health, and the impact on physical health. Regarding mortality, a review a few years ago in 2015 found that social isolation was associated with a 29% increased risk of mortality. That's almost a 30% increased risk of mortality, and that loneliness was associated with a 26% increased risk of mortality. And the consensus is that this is very much a causal relationship. It's not just a correlation. It really seems like social isolation and loneliness are causing these higher rates of mortality. And that social isolation and loneliness pose as much of a risk for mortality as other well-established risk factors, such as obesity, such as lack of physical exercise, and smoking. In addition to the consequences for mortality, social isolation and loneliness also have serious consequences for physical health. For instance, they have an impact on cardiovascular disease, and its social isolation is associated with a 30% increase in the risk of coronary heart disease, increased risk of stroke, 32% increased risk of stroke, diabetes, and also an impact on mental health. It's associated with depression, with anxiety, with dementia, 50% increased risk of dementia, shown by some studies, suicide, suicidal ideation, and so forth. So it really has a big, severe impact on mortality, physical health, and mental health. We only have limited data in terms of the impact on costs for society. One study in the States estimated that it cost the federal government, and this was mainly in Medicare costs, these are subsidized medical care, it cost the US government about $6.7 billion a year, just in Medicare costs. So yeah, we have a good idea of the impacts on mortality and health, less data on the costs for society.
Thank you, Christopher. This data seems really concerning to me, actually. And I have a grandmother, which I'm very close to, and she does live alone. And so it's very difficult for me to actually hear that, because I always wonder, how can I make her feel less lonely and isolated, because we live in different countries. And I think a lot of our viewers will connect to that. So maybe let's move a little bit more to solutions. What can we do to prevent this from happening? As a WHO expert, what can you tell us about, actions to limit this issue of social isolation and loneliness for older people?
Unfortunately, this is not an area where we have the strongest evidence. We have very good evidence on the impact, but when it comes to the evidence of really what works to prevent and respond to social isolation and loneliness, we don't have the strongest evidence. Many different strategies have been tried. Some of them show promise, and I'll mention some of them in a minute, but the evaluations of their effectiveness so far has been of relatively low quality. The findings are often inconclusive or mixed, so we're not really currently in a position to make strong recommendations about these different strategies that have been tried. Most of the strategies that have been tried have targeted individuals and their relationships. Some are delivered face-to-face, some have also been delivered digitally, and they include things like social skills training, which may involve role-playing, positive reinforcement to try to improve people's social skills, peer support in social activity groups, befriending services. These services offer supportive relationships, either in person or over the phone. They're usually delivered by volunteers. Something called social prescribing has been widely used. That's basically putting patients who are in contact with the health services in touch with the local non-clinical services that can help them in this regard. And more psychotherapeutic approaches like cognitive behavioral therapy, which tries to challenge negative thought patterns to try to change unwanted behavior patterns. So those are some of the individual level interventions. Many digital interventions have been tried as well, through computers, phones, video communication. Evidence not conclusive, mixed at the moment, so we can't say anything clear. But we have to be careful there because we don't have a good understanding of kind of the unintended consequences and potentially harmful consequences of these interventions. They may, for example, and there are a few studies indicating this, but it's not conclusive, actually ultimately increase social isolation and loneliness. There have also been a number of community level strategies trying to address the infrastructure, like making transportation more accessible and affordable. It's important to have transportation if you're going to connect with others one-to-one, improving the built environment, for example, having communal areas in buildings, public spaces, and benches. So bottom line in relation to what we know about what works is a lot has been tried. The evaluations have not been great so far, low quality, and the findings are mixed. And we're simply not in a position to make strong recommendations.
Thank you, Christopher. We will come back a little bit later to what works or the tips for people who today feel isolated socially or feel lonely. But I wanted to read one comment from our LinkedIn viewer, Marcio. He's asking, do we have any score to categorize social isolation, like a red code, to take more care about people who reached a certain level of isolation and are in dire need of intervention? Is there something like that that exists? And I guess it doesn't exist worldwide, but maybe you know of some examples.
Yeah, there are quite a few of these questionnaires that have been developed to measure loneliness and social isolation. There are actually a whole bunch of them. And some of them are well validated and they've been widely used. I think one of the most widely used and best known is called the UCLA Loneliness Scale, and it comes in a short version of 3 questions, a longer version, and then there's another one by a researcher in Holland called the De Jong-Greveld, I think, Loneliness Scale. There are also scales for social isolation. So there are many of them that exist, and some of them have been used for kind of identifying social isolation and loneliness in the healthcare setting. So yeah, there are lots of these scales available. Some of them quite well validated, others less well validated, but there's a lot available. And the cutoffs, yeah, they have different cutoffs for mild loneliness, moderate, severe loneliness, and the same with social isolation.
Thank you, Christopher. I wanted to read you another comment from our viewer. This is Veronica Douglas on Facebook. She's saying social isolation and loneliness seems to be increasing across all age groups, and asking, will WHO recommend and help in the training of public health nurses to recognize this problem?
Yeah. First of all, as I said, we're not sure whether it's increasing or decreasing. We know that since the beginning of the pandemic, loneliness has increased somewhat. But whether that will change once this pandemic is over, whenever that will be, we're not sure. But before that, the time trends weren't clear. Some countries it was increasing, in other countries it was decreasing. So we can't actually be sure, but we do know it's increasing due to the pandemic. Will WHO be training people? As I said, we only started working on this issue. We're trying to decide what we want to do, but training healthcare workers is definitely something that's on the agenda and would be very important to do. But we don't, at this time, have kind of concrete plans to be doing that. But it's definitely a very important thing to consider.
Thank you, Christopher. There is another question which I find interesting. I think it comes from our viewer on Twitter. Do we know about a link between poverty and loneliness and social isolation, or do we not have any data about it?
No, there's a lot of data. There's a lot of data, and there are many different risk factors, and people aren't exactly sure which are the most important risk factors, but there's a recent study indicating that poverty, socioeconomic problems is probably one of the major risk factors for social isolation and loneliness. And there's been quite a lot of research on this, quite a few articles published on this, so definitely poverty is a major risk factor. Maybe the most important, but we're not sure.
Thank you, Christopher. I think that's something important to keep in mind. I want to come back to the issue of nursing homes. We mentioned it in the beginning of our lives, but I see some questions coming from viewers who joined us later. So if you could just speak about it again. I have a Facebook viewer who's asking, is there any research evidence on the prevalence of loneliness and social isolation in nursing home settings and other residential institutions? So if you could just remind our viewers what we know about that.
Sure, there definitely is. I mentioned earlier that there was a review that brought together 11 of the highest quality studies on loneliness and social isolation in nursing homes, and it found that 35% of people in these long-term care institutions were very lonely, not moderately lonely, but very lonely. And I think all of them showed that it was higher in nursing homes than in the community. And if the person wants, I could always provide the reference to this study.
I think maybe we could later provide references to this study and to other studies you mentioned, especially about poverty and aging and loneliness.
All the studies are referenced in the reference section of the advocacy brief, the link to which you provided. So if you go to the advocacy brief, you have over 100 references, and it covers all these different areas.
So I'll just remind our viewers the advocacy brief that Christopher is mentioning is a brief WHO developed on 30th July, and it talks about social isolation and loneliness among older people. So this brief has been posted in our comments above, and our colleagues will repost it again for those of you who are interested. I would like to come back a little bit to the solutions. We talked a lot about the problem. I think the data is very interesting. But do we have any tips or advice for people who may be lonely themselves or may feel isolated or know someone who they think feels isolated or is at risk of loneliness and social isolation? And again, we're talking especially about older people, but I think many of this advice may work for all ages.
Yeah, absolutely. I will give some tips, but there's a caveat that, as I mentioned before, we're really not sure what works at this point. And I said we can't really be making strong recommendations, but that doesn't mean we can't do anything. So the tips we're giving at this point are very kind of simple, commonsensical things, really, like getting in touch with friends and family by meeting with them, calling them, contacting them over social media. You know, maybe make an extra effort if you know that they're lonely. Encourage them to do things with others that they enjoy, hobbies, sports, outdoor activities, etc. Encourage them or yourself, if you're feeling lonely, to reach out to local services. They can connect you with new people. They can connect you with various peer and support groups for people who are suffering from loneliness. Volunteer. Volunteering can increase the well-being and the social connection of the person volunteering, but it can also provide kind of the staff, the personnel needed for many of these interventions to reduce social isolation and loneliness. So volunteering seems to be something that's potentially very good both for the volunteer and the person then benefiting from the volunteer's activity. And this is much longer term, but think about your values. Many people are very focused on accumulating financial capital, sometimes at the expense of social capitals, not cultivating the relationship. So kind of in the longer term, sometimes your values have to be reassessed if you're in a position to reassess these values.
Thank you, Christopher. I think, of course, for many people, the concern is, well, how can we do that during the pandemic? And I will just quickly share a personal story. I was separated from my grandmother for many months during the COVID pandemic, and she was feeling very lonely. The members of family were not really feeling comfortable to visit her because of the pandemic. And so what I was doing is I was calling her every day, and we were having a little task. So she had to read a book, or she had to watch a film, or she had to listen to a concert, and we would discuss it. So that is one thing that I was able to do. And I think, people, got creative during the pandemic and trying to help people who are in their family to maybe escape this loneliness problem. I think we have a lot of tools these days. As you said, there's no evidence on knowing whether there is more harm or benefit, but some of them can definitely help. So I wanted to ask you a little bit more about what WHO is doing specifically to address these issues, apart from all these studies that you mentioned already. So to address the social isolation and loneliness among older people.
Yeah. So as I mentioned, we're doing various things, evidence and gap maps, this evidence portal, but in the these are more kind of currently and in the short term. In the longer term, we really want to implement the three-pronged strategy that we outline in the advocacy brief. And the first prong of that strategy is to create a global coalition to increase the awareness of this issue, increase the awareness of the very serious health impacts on mortality that these issues have. And as we were preparing this advocacy brief, actually a global initiative on loneliness and connection was launched. So instead of creating our own global coalition, we've decided to try to collaborate with them as closely as possible. And they have a website with lots of interesting information. They're called the Global Initiative on Loneliness and Connection, GILC, G-I-L-C. The second prong of our strategy is improving research and strengthening the evidence, especially for effective interventions. And in the brief, we lay out 7 areas where the research really should be strengthened. And really the topmost priority is evaluating these interventions better and developing interventions that are both effective and then making sure that they're also cost effective. And the third area we touch on in this strategy is implementing and scaling up effective interventions. Once we have a better idea of what works, we have to implement it and scale it up as widely as possible.
Thank you, Christopher. I wanted to ask you a very interesting question from our LinkedIn viewer, maybe tying in a little bit to what you just said about, thinking in the long term and building your social circles and taking care of your friendships earlier on. So it's a question, do you think awareness on topics like these, if covered carefully at early age in school, can help future generations to deal with emotions better?
I don't know if there's any evidence on this. My personal hunch is...
Oh, I think, Christopher, we just lost you. So let me see if you can reconnect. Oh, there you are.
Yeah.
There
okay.
you are. Yes, you are back. So just to remind our viewers, the question was about the future generations, and Christopher was telling us about if there's any knowledge or evidence about how covering topics of social isolation and loneliness early could help future generations to deal better with emotions.
Yeah, and I actually said I wasn't sure there's any evidence, but now just thinking about it, there is evidence. In a number of countries, they've implemented in primary school and in secondary school what they call life skills and relationship skills classes. They're integrated in various classes they have on health and etc. And these, I think, have been shown to help. They not only do they help with conducting social relationships, but they also help preventing violence and having more satisfactory relationships with people. So definitely, and this is probably something that should be implemented everywhere.
Yeah, that sounds very interesting. I have some more specific questions, so I'm just gonna ask a couple more. Is there any evidence that's from a viewer on LinkedIn of loneliness for those living with dementia? I think you mentioned it before, but if you could just remind us.
Yeah, dementia is one of the big risk factors for loneliness, and it actually works both ways. Loneliness increases the risk of dementia by up to 50%, some studies shows, and then having dementia increases the risk of social isolation and loneliness. So it works both ways. So it's definitely both a consequence and a risk factor for loneliness and social isolation.
People with disabilities, that's a question that we got a little bit earlier, but it just reminded me. Do we know a little bit more about people who live with disabilities and their experience of social isolation and loneliness?
Yeah, and again, they are a group who are particularly vulnerable to social isolation and loneliness. They're also a group for which many of the services for social isolation and loneliness aren't well adapted. So they're often an underserved population, but definitely disability, different forms of disability are a big risk factor for social isolation and loneliness.
Thank you, Christopher. I think we are nearing the end of our Facebook Live, so thank you to everyone who joined us today, and thank you especially to our guest, Christopher. So for viewers who are interested to read more about this topic, we shared the links to the studies and to the advocacy brief that Christopher mentioned, and you can also find more information on our website. Christopher, is there anything you would like to close with today?
I think it really is, the most important message here is that these aren't trivial problems. People think social isolation and loneliness is, well, something unfortunate, but so what? Social isolation and loneliness really have these big impacts on mortality, on physical health, on mental health. As I said, they're considered as important a risk factor as obesity, lack of exercise, and smoking. So these are problems that have very serious consequences.
Thank you, Christopher, and thank you for sharing all this very interesting data with us. I hope you will call your grandparents today, all of you, our viewers. Thank you for joining us from all over the world. We have viewers from, as always, so many countries: India, Vietnam, Bangladesh, Pakistan, Philippines, Guyana, Jamaica, Cambodia, Liberia, and many, many more. Thank you so much, Christopher, again for your time, and we hope to see you all very soon for our next live broadcast. Goodbye.
Bye-bye. Thank you, everyone.